This is Amelia Hill. I'm here to do my head to toe assessment. I have my niece here to help me do my assessment today. The first thing I'm going to do for my assessment is I'm going to perform hand hygiene, and I'm going to go into the room. Hi, Naisha. Naisha, Dr. Feelgood would like me to perform a head to toe assessment on you, just to get a general overview of you. Is that okay if I do that? It's gonna last about 20 minutes. My name is Amelia. I'm your student nurse today. Do you have any questions? Okay. Can you tell me your name and your date of birth?
Naisha Hill, October 1st, 2006.
Okay. And are you allergic to anything?
Not that I know of.
Are you in any pain today?
Mm-mm.
Okay. First thing I'm going to do is just look at her general appearance. Before I even do anything. What's her ink on here? Her skin and color are appropriate for her age. Alright, my cat is over here. No signs of distress, no equipment or deformities noted. Her body structure is upright, contour is appropriate. She is dressed appropriately. And no physical deformities. Do you know what day of the week it is?
Huh?
What day of the
Friday.
week is? What time is it?
16.
And what am I doing to you?
Head to toe.
Okay. So she is alert and oriented to person, time, and where are you at?
Your house.
Place and situation. Her behavior, her mood and speech, and facial expressions and hygiene and dress are all appropriate. Next, I'm going to do her vital signs. See your finger? Just sit that right there. I'm going to check your temperature underneath your tongue for me. (102/64). Okay. 98.8. Pulse rate is 84. SpO2 is 98. And respirations was 16. Next, I'm going to look at her face. Face is appropriate to color, skin. She does have some acne going on. Appropriate contour, no masses, no lesions, no rash. Eyes, ears, nose, and lips are appropriate to position. I'll check your scalp. No masses, lesions, or infestations. No tattoos. Next, I want to check her lymph nodes. So it's pre-occipital, post-occipital, optical, submental, submanual, pseudodigastric, posterior cervical, deep cervical chain, posterior cervical, and subclavicle lymph nodes, and they're non-palpable. Next, I'm going to do her neck, which is midline, no masses. I'm going to palpate her thyroid. Can you swallow for me? Okay, swallows appropriately. You can move your head from side to side. Turn from side to side, my bad. Turn that way. Range of motion is good. I'm going to palpate her carotid artery. And it's palpable, bounding, and jugular veins are non-visible. Next, I'm going to do her eyes. I need a pen light. I don't know how my pen light works. Oh, there we go. So next I'm gonna check her eyes. I'm gonna check her external eyes, and they're symmetrical to her face. No rashes, no lesions, no mass, no discharge, no infestation of her eyebrows or her eyelashes. Her conjunctiva and sclera are clear, pink and white. Sclera is pink and white. Next I'm going to check for her to see if her pupils are equally rounded and reacted to light. So just look straight ahead for me. And her pupils are equally rounded and reacted to light. Can you follow this pen? Just follow it to your nose. No, don't close your eyes. Keep your eyes open. Okay? And she is appropriate for accommodation. Next, I'm going to check her ears. I'm checking her external ears for any masses, lesions, any discharge. How do you clean your ears?
With the rag.
Okay, every day?
Every day.
You should do it every day. They are positioned correctly on the sides of her head, and they are aligned correctly. We're going to test your hearing real quick, okay? Can you tell me if you hear this? Okay? We're going to do what we call a whisper test. I'm gonna say something at a whisper, and I need you to repeat it, okay?
A, B, C, D, E, F, G. A, B, C, D, E, F, G. My auntie is crazy.
Okay. Next, do you wear earbuds or have any exposure to loud sounds in your ear? Okay. So I'm just gonna look in your ear. No, like I said, no discharge or drainage. No skin breakdown. And I'm gonna feel her turgor, and there's no tenderness noted. Next, I'm going to go to her nose. Her nose is midline. Take a deep breath in and out. No, your nose, not your mouth. Close your mouth. Close your mouth. Deep breath in and out. Deep breath in and out. Okay. Nose is midline. It's symmetrical to her face. No drainage. no deviated septum. Her nose is palpable. It's patent on both sides. No foreign objects in her nose. Next, I'm going to go to her mouth. Smile for me. Gums, teeth, lips are all appropriate. Open your mouth. Stick your tongue out. Can't see you. Stick your tongue down. I can see her uvula. Her oral mucosa is pink and moist. Any issues with sore throat, drainage? Okay. So, eyes, ears, nose, throat. Oh, her gums are appropriate to color. Next, I'm going to do her respiratory. You have to sit up a little bit. Sit up. Hold a little bit on the cheek. No, pull it up. There you go. Okay. So I'm looking. Her AB diameter is less than her transverse diameter. I'm gonna have you turn this way. Okay. First, I'm gonna start on her posterior back. Her back is appropriate. Skin is warm, dry, no lesions, no rashes, no mass, no lordosis, kyphosis, or scoliosis noted. Lean forward for a second. Yep, good. Take a deep breath in and out. Deep breath in and out. Deep breath in and out. Say 99.
99.
99.
99.
99.
99.
Okay. And now I'm going to listen to her lungs. Her expansion is appropriate. Tactile fundus is appropriate. So now I'm going to listen to her lung sounds in 6 to 8 positions. And just take a deep breath in and out. Okay, lung sounds are clear. Have you turn back around this way. Now I'm going to do her anterior chest. I'm going to look at the skin, no lesions, no mass. She's not using her accessory muscles, no distress. I am going to listen to her lungs now on the front side. And no burping. Okay. Lung sounds are clear and appropriate. Is any of this tender? Okay. So I need tenderness. Next, I'm going to do her cardiac, which I've already stated that her jugular vein is not visible. Her carotid there you go. There, you lost your carotid. Your carotid vein, carotid artery is bounding through is present. And now I'm going to listen to her apical pulse, which is at the between the 4th and 5th intercostal space at the ventricular line. Okay. And I'm able to hear her apical pulse. Now I'm going to listen to her heart sounds, starting with the aortic at the second ventricle, and I'm going to listen to both on the bell and the diaphragm side for each heart position. That was the aortic. Now I'm going to listen to the pulmatic. Next is Erb's point. And Erb's point is at the third intercostal space. Next, I'm going to listen to the tricuspid, which is at the fourth intercostal space. And the mitral, which is at the fifth intercostal space at the mid-clavicular line. And now I'm going to palpate her radial pulse to identify if there's a pulse deficit. Okay, so now we're going to move to the sofa. Have you lay down. And we're going to do her gastric. Her knee is ashy. Pull yourself down just a little bit. So the first thing I'm going to do is I'm going to look at her belly. Her abdomen is appropriate to color. There's no masses, no rash, no lesions. Oh, I would not touch her first. I'm just going to be looking. So there's no rashes, no lesions. I'm going to listen at her xiphoid process for pulsation. That's good. Next, I'm going to also take her bowel sound starting at the right lower quadrant, left lower quadrant, left upper quadrant, and the right upper quadrant. And I will do this for at least a minute each quadrant. Bowel sound. Bowel sound. Okay. And now that I've listened, now I'm going to do light palpation. Any pain? Alright. Have you come back over here? Actually, before we do the next thing, we're going to do your musculoskeletal. I'm going to have you stand up for me. I'll have you go to the wall. I'm going to have you walk about 10 feet back and forth. And now I'm just assessing her gait. Turn around, go back. Seeing if she's having any issues, like she's off balance, and she does not. Come to me with the foot. Have you face me. Have you do your arms like this. No. Like this. And push up. Push down. Cross your arms like this. Squeeze. Squeeze as hard as you can. Okay, she's got good strength in her arms. I'm going to have you do like this. You're going to touch each finger to your thumbs. Back and forth. So she's good with coordination. Sit back down. Now I'm going to check your refluxes. Now, you're probably not going to have too many. So, this is her brachial radial, her bicep, and her tricuspid. Okay. Okay, her popliteal. And then we're going to do her dorsal pedal. Okay. Arms. Push up your legs on the arms. And push down. Okay. Let me stand up one more time. I'm going to do a balance test. Have you close your eye, put your arms out in front of you, and close your eyes. Can you lift one foot off the ground without losing your balance? Okay, do the other foot.
Yeah.
You have a hard time with that one?
Yeah.
Okay. All right, have a seat. Balance is not that great on one side, but overall balance is pretty decent. Next, we're going to go through the cranial nerves. So, the first cranial nerve is for smell. I got some aromatherapy. And let's see if she picks the right smell. Can you tell me what this smells like?
It smells like a lemon.
Something citrus type is orange. Okay. So next we would test the second cranial nerve by checking her visual acuity by doing an eye chart, but I don't have an eye chart. But she doesn't wear glasses. The third cranial muscle is eye movement, and that would be eyelids. Can you open and close your eyes? Okay, that is appropriate. Next is going to be eye movement. Can you look down? Fourth cranial nerve is, no. One is smell. Two is visual acuity. 3 is opening her eyelids, eye movement. 4 is moving her eyes down. 5 is facial sensation and chewing. You have any issues chewing? Pretend you're chewing something. Chew. Just maybe move your jaw. Chew. Okay. I'm going to have you close your eyes. I need to tell you where I'm touching at. Without looking. Close your eyes completely. Just say where I'm touching.
My cheek. My forehead. My nose. My chin. My other cheek.
Okay. So that's appropriate. Next, we're going to do eye movement. Can you move your eyes back and forth? Okay. Next is going to be facial movement and eye close. So I'm going to have you do like me. So she's able to move her face and close her eyes. We're going to do your hearing again, even though we've done your hearing already. Just tell me if you hear this.
Yeah.
Okay.
What you doing, girl? What are you doing?
Okay. So she's good on her hearing. And we've already done her balance test. Next, I'm going to look at your uvula again. That is the 10th Crayon Nerve. Tongue out. Okay? And swallow for me. Okay? She is able to swallow appropriately. The 11th Crayon Nerve. Let's move. Well, we are almost done. Move your shoulders up and down. Okay? And now, the 12th Crayon Nerve, stick your tongue out and move it around. Okay? So she is able to move her tongue around. And that would complete my head to toe assessment. Are you in any pain?
Mm-mm.
Are you comfortable?
Yeah.
Do you need anything at this point?
Yeah.
Okay. I want to thank you for being my volunteer. I really appreciate it. And at this point, I would perform hand hygiene and document my findings.